My name is Lisa Peterson, and I'm going to be presenting our project for Group 5. We chose the project of emergency room wait time reduction. We started by doing the weighted scoring model. Now, we are all healthcare administration majors, and so we decided to pick projects that we could see ourselves doing with our future careers. Now here you can see that the emergency room improvement plan, which we did choose in the end, had the highest weighting. These were all great ideas and they all scored really close, but this was the one we felt would be the most valuable, as well as one that would be really interesting to look into. So for our project decision, if you look at this chart here, you can see the average emergency department wait time according to their need for treatment. Those that come in with immediate need, which is about 2% of the visits, only wait about 28.9%, whereas those that come in with urgent, which is about 41%, have a longer wait. We decided to take on this task and find a way to reduce the wait time in emergency rooms because we feel like it will improve the patient satisfaction as well as the provider's stress load and our overall satisfaction in care. So this chart here shows the wait times for the ER in the United States. And as you can see, the highest over here, Maryland, Maine, New York is in there. They have the higher wait times. They're also the more populated cities. And as you come down here to the end with Montana, Idaho is in here, and Colorado, we see that the wait times are lower in the lower populated areas, and we'll talk about that a little later. We feel that there's a significant need for reduced wait times in emergency rooms all over the country. If we can come up with a plan that can be implemented in the ER to reduce the wait time, we feel that this would help increase the revenues possibly for the facility, as well as drastically improve the patient experience at the ER and also the physician experience and stress load. The average wait time total for all of these in the United States is about 30 minutes. For our scope, if you look at this flow chart over here, we started with our idea, determined the functionality of it, and then decided what information we needed to gather. And because we are healthcare administration majors, our project is going to be a little bit different. It's going to be more of a thorough report, research on ways that we feel would decrease the wait time, and we're going to reach out to different facilities, ER facilities, to gain information from them and determine if this will be something that they feel would decrease the time. So the first thing we're going to wanted to look into was what they offered for registration methods. Do they offer it online? Can patients schedule ahead of time if they have non-life-threatening illnesses, so that when they get there, part of all of their paperwork is already complete, they can just skip that part and their wait time is decreased. We wanted to look at the doctor-to-patient ratios. Doctors that have more patients to go through, obviously, are going to have a higher wait time at their ER. Doctors with less patients to get through are going to have lower. So we wanted to just talk to the facilities, kind of find out what their doctor-to-patient ratios were, if it affected their wait time, if they felt like it did, or anything else that we might be able to find on this subject as we talk to different facilities. The third one was efficiency systems. Now, an example of an efficiency system would be something that is known as the SORT program. It stands for See, Order, Treat. And it's a program that utilizes providers so that they're examining the patient in triage shortly after that patient arrives at the hospital. So they implement a way to change the way they do things to make it run more efficiently, to get patients through quicker. That's something that we want to look into the facilities to see how each one does it, if they have plans that they do that when times get busy, if there's different way that they do things, a system that they implement to get through people quicker, to make sure that the wait time is staying at a decent amount of minutes. The last one here refers back to this one that we just discussed with the location and the rural having the lower wait times versus the city. We just wanted to know if they felt like that was something that influenced it, or we wanted to find out if the rural hospitals maybe did something different and that's why their wait times were low. We just want to figure out any type of information we can on this to see if location influences the wait times and how that can be managed differently for the different wait times. For the time, cost, and feasibility of this project, as you can see in our Gantt chart that we've started on, it's not completely finished, but it gives you an idea of what we've got. We've got the 5 different phases that we're working on, and it coordinates with the times, with the different weeks that we have to complete this project. Right now we're on the first one, and we're about 60% complete because that's how far through the week we are. So the anticipated time for the completion of this project will be from now until week 8 of the semester. It's going to require several hours a week of research and communication from each team member, as well as with any hospital staff that we can gather information from. For the cost, we don't really anticipate much cost other than fuel cost if we were able to be allowed to go visit an ER so that we can gain a better perspective and see how things work and get a little more information that way. For the feasibility, we felt like because our team was healthcare administration majors, that we would have the capability of finding the resources that we needed and reaching out to these different emergency departments in the different states to find out how each one functions and to find a way to reduce the time based on what we figure out. The diversity of this information will allow us to come up with an overall plan of action to hopefully decrease wait times. These are just a few of the hospitals that we would like to get in touch with. They're all in the same state, but they're in different areas and different populated areas. So it'll be interesting to see how they do things similar, how they do things differently. For the quality, we feel like the success of this project is going to be by using those 3 to 4 steps that we've talked about before and seeing if they would be able to realistically improve the current time in their facility. Some of the potential risks, because this project is different than what some of you guys may be doing, is that we might not be able to gain access that we want or information that we're going to need from the hospitals. We may get too much and it'll be too broad once we gather it all. And because of our limited time frame, we won't be able to narrow it down to what we want it to be. And the last thing that makes it more of a risk is not being able to communicate the vision of this project as effectively as we'd like because of our different majors, but hopefully that won't be the problem. The resources required for this project will include our 4 team members, the local hospitals that we'll hopefully be able to get thorough interviews with, computers, excuse me, sorry, databases that contain certain books and information and articles that we need, and websites that allow communication, such as Google Hangouts. Another resource that I feel like is going to be very handy for us will be the information that we receive from anyone that we can get in touch with that works in the departments of the hospital that we're looking into. So this gives you an idea of the project that we're looking into, and hopefully you can see the unique interest we have in it and be able to hopefully be interested enough that you will be looking forward to what we come up with.